are you feeling? Yes, you. Did you know you are now living 30 years longer than you would have 100 years ago? Our health and community services industry works to make sure you're well and living a long life. They don't just try to heal you when you're sick, they try to do things to stop you getting sick. Hold on, are you okay? Do you need to go to the hospital? We used to go to hospitals a lot more. Now we want to stay at home and get the help we need there. We don't just need a doctor. We need the occupational therapist to help you at home, the nurse to check your blood pressure, a home care worker to help with the shopping. More and more jobs are being created to make sure you live a long, healthy life. But to do this well, we need to make sure training is there for new roles and new ways of delivering health and community services. Did you know over 1.3 million people work in health and community services? But because we're an ageing population, we need an extra 25% more workers by 2025 to make sure we're all taken good care of. Mental health. Don't think it affects you? Well, chances are it will. 45% of us will experience a mental health issue during our life. The problem is, there are only 26,000 workers in mental health. Did you know that's only one for every 420 people who need help with their mental health? Now, if you have a disability, there's only one worker for every 95 people who need disability services. Almost 500,000 children under 5 have been identified as needing extra help to make sure they develop into adults who can live a long, healthy life. Did you know that over 500,000 of us are Aboriginal or Torres Strait Islander? And over half have diseases that can be prevented. Are you feeling older? Well, we're all getting older, and by 2050, 16% of us will need aged care services. Here's the problem. Out of the 300,000 who look after us when we get old, 60% will retire in 10 years, and in the next 20 years will also need aged care services. We need to increase the number of aged care workers to 830,000. That's a huge 272% increase in our current number of workers. So what are we doing about this? Good question. We've been looking at many sectors of health and community care and finding ways to make sure we have enough workers to take care of us. We need to give new and changing roles to more and more workers. We need to do this together. Let's talk about it, tap into government initiatives and funding to help us, and find new ways of making sure we're healthy. We need to equip registered trainers so they can provide quality training and produce lots of excellent workers. Let's find ways to increase the skills of existing workers so we don't lose them and they can offer us a better service. So how is our caring industry feeling? Not as well as it should. But now is our chance to prevent critical workforce shortages by working together to help build a strong and vibrant health and community services industry. Visit CSHISC.com.au and download your copy of the CS and HISC Environmental Scan reviewing changes, challenges and future directions for Australia's caring industries.